Alright, so was your phone, your mission, Dindi no go artist. Aha. I got on Sam TV. Mr. say, Ober subscribing to the channel, no far why you Cherabra our comment section. Yamisha baby. Like and a share. I wish for rough issue. Any rich hospital, Pacho, Assembly and Chai. And nurses no. Eba bonte bekasaye. See committee na yera akando si wati ye no eyen trobe chan trobe Ghana for enim. You see akando ni committee na also wati ye no say onko hwehwe de esi wo a rich hospital and do ombe ka kire say na nurse no ya anye ne hwe no nurses for eba bonte beka kire say omu be try and trop papa abusiafo umayenko na yenko tie dia umuwoka na yeba yebetu aso na mishirabi.
Now after this medical report, I am taking you back to the health information management system of the Ridge Hospital. Now report here committee at the bar. The doctors are one more share nurse, in the first instance, I am putting it on record. Say committee Nejuma one year, they did not interview those doctors. The medical doctors are one medical share baba wado ye nurse na all complaints say rough about hospital or the Nsaki Kano no doctors they did not interview them. The committee did not invite those doctors to give the account of a niema woman's year examination examine baba wado hu ye. They didn't call them. They didn't invite them. And see, how do you conclude this? And ya no crack so be inside kika will be and ya no crack send no be near fracture and ya no crack send no be near dislocation. How do you conclude on that? At the point where you are doing pick and choose, nipa won pese o favor do ka wa asem ma no wono no mom na okọ ne nchen se wo bebisa na asem. Now Kwame for health information management system no records no fato so wait ebema the time ebema the dates ebema doctor nia no wo hwa baba wa no at the time ayeka ho asem. And then clearly you will see the unfolding stories on day-to-day basis. Debia womo behwe baba wa ni bia reporter doctors no etro through the health information management system. Sa information management system kroyana committee members no person omo kire ye say girl no amfa video evidence bia to back his claim say Rafa the Nsaki Kano. For that reason, they went on to the information system and then they realized that based on the complaints a girl no at the bar, doctors no aheno. One more here the one more man pain relievers. One more man psychologist, one psycho because of the incident I see, which is not true. Kwame, for records neto sumami, Harry, manin for records neto sumami ni enkoyedi. So this is the country we live in, and you ask yourself, say, DNTR and Niema SSACC in this manner. I will not tell you my source, but this is on the 24th of August. The last one, Debbie Kwame Yan started from the 18th. The very first date I led Echo Hospital Hall. Na Yemra on the 19th. Na in sequential order. Yema date. Why do we do this to ourselves? We are a disgraceful nation. The public servant, the people we are entrusted with our power, they don't respect us because every day, every time they are lying to us in our faces. And yet, what GP? They think say your politics. So they play with human lives. Thinking say human lives, no, it does not matter because of what we said politics are what we ain't. But we do not care about it. Yeah, and fire. We will tell you the truth. After you have been exposed, you will know, say you have been exposed. Why do we do this to ourselves? I didn't say yes, sir. Kwame, me simba mi dates a hodo ano. From the 18th to the 19th, eba besi 24th. Okay, all the records are there. Media said the motion na mo fe no ntoto so. And you be reading doctor by doctor. Henry, just come inside and then read it. We'll read your screen. This one here, what the doctors are saying.
Abuzafo, semwa mutie. Yera kando. What are you trying? Settings better ya. Mupese mufa Ghana for nyina mupese ye Jimmy ye nyina na say then na mupese moye. What at all it's so special about this guy? I say you people are trying everything possible to protect this guy. And then I say, Siciano, you people are doing everything possible to support and I said to protect the guy. Abra, muamunim said the ono wayena and fam. I was have Mama Yanko share video no na the air canon buy a better.
So once Ransford sees Ralph coming in, Ransford says that because he knows him on social media, he will, oh Charlie, and this I'm quoting him.
Okay.
So then Ransford per West says that, hey, that's so boss. So he calls me boss. So boss, I saw that. I have to be careful because Charlie wasn't in the mood. That is when all those started. Then Ransford got him to sit down. Then he checked his vital signs. In my hospital, at the triage, once you sit on the table, care has begun. Care is not when I start putting plaster on your hand. No. Then you don't understand emergency care. Once you sit on that table at the triage, care has begun.
Okay.
Because with that, I can use my discretion to say you don't need health care because it is on the policy that there's a senior healthcare professional discretion to be used at the ED.
Okay.
Okay, so yes, you were telling us how the assault on the Rejoice happened.
Yes. So once you see, at the ED, you can't just start and go to assault. So I have to be I have to go through the process.
Yeah, but Sarah,
so once you are done, so once he's done, once Ransford was done, Ransford did not gather a lot of information to whether note. So Ransford at the point in time when he saw this, gave him a green and a yellow, and that's color codes. Araba knows the color codes. So once you get to yellow, per the system, you're supposed to wait for 60 minutes before you are being attended to. So Ransford could not gather other information because for all you know, he had actually hit his chest against something. So you have to talk to me so that I can even upscale your color to, let's say, an orange or a red so that you get an immediate care. But since you say you won't talk to me, let's stay at what you have brought. And that is yellow. So go and sit at the trauma room.
Okay.
So now, Araba, are you listening to me now?
Yes,
so now we are going to the trauma room. We get to the trauma room. We give him a chair. He sits down. Then the trauma room normally closes because of what goes on in the trauma room. Because in the trauma room, you can have head injuries, you can have people with accident and lesser. But this is a small room with just one couch. So if I have 60 RTAs today, I can only attend to that one on my couch. Okay. You could be dying for all I care, but it is what is here in the trauma room. And I'm saying trauma room because if it is in the ambulance area, the triage area, then we will do something and wait for the trauma room to be ready.
Okay.
Because that is what we have been told by training. So that even at the triage, we have simple triaging and advanced triaging. With advanced triaging, senior nurse who is in charge can start something.
Okay.
But now that you are here, I'm done with my work. So he saw somebody there and then confronted them, according to the report, confronted the trauma nurse and said he wanted to do a card, blah, 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 all those things. I don't want to talk about this because of time. Then the trauma room nurse says, go and do a card and come. So when he stepped out, the trauma room nurse said she thought he was going to do the card and come, only to be engulfed by that number of people. Now, this is where the beatings came. It was at that level that Ralph, went to call people that the video came out anyway. So all that I'm saying is not captured on his phone, but is it on the triage cameras or wherever information I got mine. Now, when he is coming out, because of the rage they have encountered in the trauma room, they met my sister, the rotation nurse, standing at the AD, washing her hands. So Araba will know where I'm talking about now, because we have a place where we wash our hands. And that is where she got her beatings.
So she was actually beaten.
So you see, I'm so happy that this report said they went to their limbs on the next day.
Yeah.
Because on that day, the anger at the ED, nobody told the girl to go and do a card. It wasn't about go and do a card and let me put every information on their limbs on that day. So on that
I say, young coca say, nurse for the share that, echo dwene ho,
ena wo mo se ya bo maame no aya amo no ye nyina follow social media ye follow hu de o mo ka ya difo wo mo boa. It is not true. Ya bo ge no wo mabo no and it's on record. Right, show that stabilization and omukwere omuwie omo say polycontusion. E kwahye ho wie ye no. Diagnosis omudi come police for ye polycontusion secondary to physical assault. Na doctor na o chere say be wan go school. O ka so onim na adwuma. Asema aba aye sabi political aye famous. O de obeye bone kora asema sa na nko doctor no ono abaya wo dwene no ho nko obekwa ko say ni din. So what you say? Poly, you can't poly. Your words to be one here. Poly, multiple contusion. Say baby, a whole dufuo, a while a while call, a while ya. Say multiple. Say baby, a yanny baby. At the end of my master, I buy an old hand or then who bought him.
Nasa I minimum say doctors and nurses are more juma or hospitals, you know, say dream rebiness say monso moya DNS will be as sanwa. Monso more home quine say, Mobeba bontin so become a doctor near me share no. Name on report na a day by nature say nipano ya sotono. But me doctor na me share no me report to say ya sotono. Emma, this is my report. I know you to me man in your public man in ye.
Obi asuru ene obi adwene no ho me ka akere opa ba maame no hwe no omie na no emeka sa wa abonten na won hwe attack me ye kasa akwa ye se me wa shantere nya adenti na maduru ho kwa unhunu de aye me social media unhunu de aye me Kevin tell apost to me give me baby wo me na asefo nyina de abetudwa me boa me so obi anim se me yekurase de obi anim baby me firi me na asefo mu ni me ene omuto ma ba ma me na me ye mo adwuma so what you say they know me ya dig me and now be the abeto me so say me kra no me ma ya de play the farm me kon kran say yenko ye story no me ma fasika 3.8 million Ghana cedi 38 billion minim what you say ya de smia o na ya bo hu enti you kan kra me na me ba me yire tumi fo kwa me wo ko ne nya abotre na bibia betimesi me sero nya abotre on say di hu hye bi mu na busuafo so dome me be meja me mafie so what you say enti ne esuro enti doctor no na wogro ho no ote reji ejina ni kakra na ote nkra no onye rough ye me ma so bole unti say nurse ni ye in charge of training ewo ho our rich hospital some we see ani akopani political party affiliation ni ya sababule no wo na aseda ni e show no sabi nurse ni abaya wo sua nwoma double masters edi ye clinical coordinator boa na clinical coordinator no mo na hwe rotation for no so ne students ya abadi nyina so na adwuma on in service training coordinator na adwuma no in service training coordinator enunti ya be bule no na tese ye di hu asem no obi atu no fo sa na ti o enu bi na omo ye na as a doctor no so wo meka say the report na ba nya no kore against the ministry and whole government ya kore ye kase amanfo odwene ye ho say asem be de betima tomo because say me mepie kora na achi me aminim sort ya say mepie ni achi me aminim but
that's musuru
yesuro I'm telling you, one thing say, you see a national executive in India Kasa, as soon as you own a regional executives in Kwana Kasa. Dr. David Tinkuna Chimuhe do Mayano. Oma did not tell my Jojo no I be because Obi Chantro said, you're coming in a correct quanti, the my Dr. David Tinkuna Chum. So what you say, what's your report to Mupa? Almost say, nurse for a bear Juma earlier this year. Department or no 88 and now almost what 34 now me the brofu bi share ho o ma vacate post what you say just o ma frejuma o ma ankra enti o mo ko hen
o
de obaduru o tirim bi afa o mo ko
na zo mu nso o mo life at risk
onim adwuma no nya rewarding and the nursing no me and then status me amatwere ho say me ana na metu nkura ne fo se montena ha ye nyina etina ha na nye bad saa ti montena ha enso na akura bia wo so obekọ abrochire bia meturu fo so wonko
because
me maka ne radio so me se obi a so wɔ kwa abrochire nurse ni a so wɔ kwa abrochire ya me Joseph Free Anto mu amatumfo se munya akoro na munya adwuma Ghana na munko school kakra nka ho munya ni nyina no mesrɛ mo ma withdraw sa afutuo no because him one adwuma a yɛ no wakatu yesua yensa mu enti na onim se nka mother ministry kura so de nka wɔkorɔkorɔ na wɔne wo nyina adwene hefo no ho na yeye ne mother ministry na nkasa so ane nursing profession ne midwifery profession no ko kana de anim se amanfo ne beka se nurse fo de atam omumu ade na nka ministry ne yenyina ye hwekwa ya de befa so nye show discipline enya admission ni say yenye ni say ena de ministry na nkasa ahyehye ntoro abetwa agu ye so enjoy